Welcome to this episode of the SSI Executive Conversations Podcast. On this episode, Darwin welcomes Dr. Elliot Street, CEO and co-founder of Inovus Medical. Darwin and Elliot dive into the foundings of Inovus and how they're revolutionizing surgical training technology.
Welcome to the SSI Executive Conversations Podcast. Today's guest is Dr. Elliot Street, who's the co-founder and CEO of Inovus Medical, a multi-award-winning designer and manufacturer of surgical training technology. Elliot holds a bachelor's degree in anatomical science and graduated summa cum laude from the University of Manchester Medical School in 2013. Following graduation, he worked at the world-renowned Oxford University Hospitals for 5 years, has experience across general, pediatric, and trauma surgery. Elliot's received over 20 clinical excellence and innovation awards and currently works with NHS England as an alumnus and mentor on the NHS Clinical Entrepreneur Program, where he gets the opportunity to advise clinical entrepreneurs on the commercialization of innovations across the NHS. Dr. Street also holds a position on the Liverpool City Region Innovation Board and is a strategic advisor to the Liverpool Ventures and Liva Labs. So that's a hefty introduction, and I don't even think we could probably go on for another at least 20 minutes. But welcome to the show, Elliot. It's great to see you, and I'm really excited to have this conversation.
Yeah, lovely to see you, Darwin, and thanks so much for having me on. I'm looking forward to the conversation a great deal.
Awesome. Well, let's jump right in. You've got a background, obviously, in medicine and sports, and I'd love to start out by discussing how the idea of Inovus got started and your reason for building this business.
Yeah, thanks, Darwin. And much like that intro, this answer may take a little while, so strap in everyone and bear with me. I'll talk a little bit around why we started the business and what the innovation was for it, and then I'll come on to the problem we're actually sort of solving today. We founded the business 12 years ago. I've got a co-founder, Jordan. He's our CTO, and I run the commercial side of the business and obviously bring the clinical side of things to the table. And we both come from sporting backgrounds. We both played a high level of sport. And 12 years ago, the problem we were solving, the problem we recognized was, as people who were going into a surgical training career pathway, we couldn't understand why surgeons were not training more like elite athletes. So in inverted commas, the simulated environment or the practice environment for elite athletes, where they're breaking skills down into smaller chunks and then bringing them together in a simulated environment, i.e. practice games, before going into game day and walking onto the field. Conversely, surgeons, the way they were training 12 years ago is very much like see one, do one, teach one. The majority of the learning curves at the patient bedside, and really all your practice and learning is on game day. We looked at this 12 years ago and said, okay, why has there not been a paradigm shift that has allowed the surgeons to train more like elite athletes, and more specifically allowing surgeons to gain that early learning curve in the simulated environment away from the patient bedside? And we highlighted that simulators already existed. They were just very expensive, difficult to scale and access, and they weren't overly realistic. They were often using virtual reality as a modality to provide training, and that has drawbacks in a number of areas, namely haptic realism, so how realistic it feels. So that was 12 years ago. We founded a business based on those fundamentals. We made those issues our core values, so we decided to make technology that was more affordable, more accessible, more functional than that came before us. And we started building a business with a view to shift that paradigm. So let's have surgeons have the early learning curve away from the patient bedside. That's better for the patients, it's better for the surgeons. And the theory was we'll be able to train surgeons more efficiently and in high numbers. Fast forward 12 years. We've operated with patient urgency, because those that think they can come into medicine and move fast and break things will be mistaken. You have to be urgent and move at the speed that's appropriate for the sector we're in. So we've been very patient there. But over those 12 years, things have changed a little bit. Where we are now is that every year globally, we're 143 million surgical procedures short. And that is simply because we don't have enough fully trained surgeons to meet the global demand for surgical care. And what that's actually translating into is 1.5 million preventable deaths per year. Now, to frame what that looks like, that's the same number of preventable deaths that we have from HIV, malaria, multi-drug resistant TB, and complications of pregnancy combined every year. So 12 years in, we've built the platform and the technology to solve that original problem, but we've also built the platform and technology to solve what is today's problem, which is we desperately need to train more surgeons quicker. And we've got some great evidence behind how our platform does that. And I'm sure we'll get into that a little bit later on.
That's astounding. And I was thinking about when I first got into respiratory school and, trying to learn, I think about proactivity and reactivity, right? You have to be able to, I think proactivity is always the better pathway in terms of preparation and how you look at things. But even in critical situations, right, you're practicing proactively, just like you talked about. So then when you get in the situation, you can react in a successful manner and do it consistently. And in having the ability to do simulations, because back in the 90s, right? You're trying to learn all these different clinical aspects in terms of ER, intubating people, and then actually do it under pressure, which was truthfully terrifying. even though it wasn't something that you would necessarily talk about, and then you do it enough until you get comfortable with it. So I think everything that you just said, and you think about sports and obviously clinical outcomes in lives, is a lot more valuable, relevant to the entertainment of a sport. And so I think the priority and the importance of your mission can't be understated. So I thank you for laying that out. But you kind of already talked about, based on the numbers, the value that Inovus brings to the industry. Where is the company currently at in its growth stage? And certainly, if there's extra that you want to add on to the value, but I think the importance of the value can't be understated.
Yeah, thanks, Darwin. And the best way to answer that, I can actually answer most questions I get asked about our business with our mission statement. So all of what I spoke about at the start is distilled down into a very clear mission. And our mission is to become the world's partner for surgical training. Now, what does that actually mean? When we've achieved that mission, and this is a multi-decade mission, which is going to answer where we're at in terms of the growth journey in a moment. This is a multi-decade mission. When we have completed it, every surgeon across every specialty on the planet will learn every single one of the procedures that they have to do for that specialty to an objectively measured standard away from the patient bedside on our platform. That is a massive mission.
Yes.
It may be more than multi-decade, given the scale of it. So when we think about where's the scale of the business now, the business has grown considerably in certainly the last 12 to 18 months. We're now an operation that has a global headquarters and a global manufacturing hub in the UK, US headquarters, and direct teams across the UK, the US, and some global teams that are growing. I would say, are we 10% of the way onto solving our mission? Not even that much yet. And we're around an 80-person business with those sites across the globe. So hopefully that gives you an idea of the scale that we've got to so far. We started literally in a bedroom with a heat gun and a sheet of plastic and two lads in their early 20s. So we've come a little way since then, but we've got a heck of a long way to go. And the thing that really pushes us forward is the thought process around if we actually achieve our mission, by default, we will solve that problem that is now the problem we're looking at. We'll solve the problem that we wanted to solve when we first started, which is everyone training the way the athlete can train and should train. But we'll also solve this very emergent problem that we have 12 years on. So that for us is what keeps us going, and actually makes us galvanized in the fact that actually we're very, very early on in the journey here.
Well, and you look across data across decades and decades and lots of data points, and the reasons why businesses succeed or they fail over and over again come down to 7 to 8 reasons. And certainly leadership, relevant to mission, vision, company alignment or misalignment, and talent are always some of the critical aspects of success or failure. And I would actually look at some of the other reasons kind of come back to leadership regardless. And so your why is not only noble, but it, from an efficiency and what it can do for the system, it brings incredible value. So that's pretty exciting. And I always talk about mission and vision and how important it is. It can't be lip service. It has to come right off the tongue. It has to be a way of life, and attracting people that's their personal why. It's going to resonate with that. And so I love how you just brought that right off the tip of the tongue. And I'm excited to see where you guys, I mean, obviously you've come a long way, and I think the future is going to be very bright, not only for the company, but for the healthcare system, how much it's going to benefit from the technology. So why'd you start the business, and how has the market changed? And I know you may have touched on this a little bit earlier, but well, no, you did, in terms of access, right? In terms of the amount of physicians, but first 12 years versus that mindset. And that's another one of the reasons why companies don't succeed, right? Because they can't adjust in changing markets. So that's a great segue into how you're adapting.
Yeah, and I think thanks. I think when we started that business, and again, that why being, we want to shift this paradigm. We want to have the surgeons training away from the patient bedside, allowing themselves to gain their skill sets in a simulated environment, the practice arena. When we first started, we started out with the concept of, we're actually going to create a product that surgeons can access by themselves, so surgeon by surgeon. And it comes back to this where we are now, this sort of scale of the issue is that's good, and that's still an important part of how we access our markets. We offer simulators that are a fraction of the cost. So think about IBM versus Apple. But both great companies, both a huge amount of respect for them. But in the early days, we are taking sort of the Apple pathway in terms of saying, let's take a technology and put it in the hands of everyone rather than the hands of a few. So that analogy is how we started out thinking, and we still think like that. But in terms of how we access the market and provide services to our partners and our customers, we now think about that at a much larger scale through partnerships. So I mean, last year, a good example of this is we were very, very lucky and very humbled to agree a partnership with the AAGL, the American Association of Gynecological Laparoscopists, and Hologic, large strategic medtech. And that partnership is all focused around delivering a standardized curriculum for minimally invasive surgical skills to gynecologists or gynecology residents across the whole of the North Americas, basically. So that partnership model is allowing us to have an impact at a massive scale. And it comes back to the concepts around how we've built the technology, which is we wouldn't be able to bring that partnership together between those parties without having a technology that is accessible, and both in terms of a cost, but also a footprint and a scalability and a standardization perspective as well. So yeah, that's how things have changed over that period of time. And for anyone, like, and aside from, obviously, hopefully we'll talk about sort of talent, accessing talent and building that, but anyone that's listening that's just interested in innovation and building something, that's been really, really interesting for us, seeing that model evolve over time. And that's not easy, but we have built into that. So if that had opportunity come along 12 years ago to have the ability to put our technology in the hands of every resident in the whole of America for gynecology, we probably wouldn't have been ready 12 years ago, as much as we would have wanted to and given it a good crack. Now we've built a platform that means that we are ready for that. And so as the market has evolved, we've been able to move with it and put ourselves in a strong position to ultimately provide value to our partners. So the societies, the medical technology companies, and the residents.
And I mean, obviously raising capital and sharing your value prop there's a lot of different companies and ideas that are vying for that capital. And so that's obviously a challenge, but in terms of how smart strategic partnerships are becoming more and more important, more so than they ever were, 15, 20 years ago, as we mind share and try to get to improved outcomes more efficiently. So that's exciting how that you use that in a strategic manner to start getting that awareness out there, and what that's going to do as you continue to grow. You've been in medicine now for 17 years, and obviously the entrepreneur track, right? And I think that more and more we're seeing people from medicine with ideas that are choosing not to just try to, maybe sell an idea. They're moving into entrepreneurship. I just had this conversation with Margaret, the CEO of Rapid Nexus, who's a surgeon and had an incredible idea and has done multiple startups. So let's talk about the transferable skills from medicine to entrepreneurship.
Yeah, I mean, there's so many. Apologize for me clicking my chair there. Sorry for the bang in the background, everyone. So I think one thing I'd love to start, because actually this is like fresh and front and center of my mind, is communication skills. So depends which medical school you go to, but on the whole, when you go to medical school, you're effectively and depends whether or not your program is 4 years, 5 years, 6 years at medical school, depends which part of the world you go to. But on the whole, they are very, very geared towards teaching you to become a very good communicator and using lots of different tools. So there's two tools just in the last 24 hours that I've used, that I learned at medical school, that I've integrated into the business and that we use all the time. So the first of those is this framework called SBAR, which is a framework actually developed in the military and used now in healthcare very widely, which is all about handing over a subject. So when you come to the end of a shift and you've seen 40 patients in the last 12 hours and you need to hand those over succinctly, because if you take an hour to hand over 40 of them, you'll be there next day still telling the next team about it, right?
Exactly.
So SBAR is this framework for delivering high-level information and making sure that coming out the back of that high level of information, there's a very clear request. The R stands for request or recommendation. So a very clear request or recommendation to the person that you're speaking to, so that there's no ambiguities around who's, and to use a rugby term, but also this is a football term in the US, someone has to have their name on the high ball. Like that ball's in the air, someone needs to catch that. It needs to be really clear who that is.
Right.
So SBAR as a tool, unbelievably powerful. Every person in our business uses SBAR, and it came directly from medicine. It helps that we've got quite a few of these entrepreneurial minded physicians and clinicians. We've got midwives in the team. We've got former nurses. We've got surgeons working in the business. So they all learned this, but it's so powerful. It's so powerful that actually before we started recording, someone walked into my office, didn't use SBAR, and I asked them to just turn back round, go away, create their SBAR, brought it back, and they got a much better answer from me than they would have got with the original approach to coming into the office, because I wouldn't have known what they were actually asking me to answer. And very quickly then you think about other transferable skills, especially for those going to leadership roles. Like it or not, at some point in time, you're going to have to break some bad news to someone in business. It's a difficult thing to do. That could be, you've got 3 candidates and you're only hiring one of them, and you have to tell 2 of them that they didn't get the role, and they could be amazing candidates. It could be that you've got 3 suppliers that you've run a process for, and you're telling 2 of them you're not going with them. It's not what you say, it's how you say it. And the framework for breaking bad news that again comes from medicine is so powerful, and we use that all the time, so that when we do have to do it, people go away with a positive view on that. So I could go on and on about the transferable skills from medicine. Those are 2 examples. I think they're super powerful. And if anyone is listening from a clinical background, a lot of people go into business or innovation or entrepreneurship from medicine and from a clinical background thinking they don't have the skill sets that they need, but they've got a tool set that very few people on the planet are privy to having, and it's really helpful and super powerful.
Oh, it's such a great example. And there again, you systems in place to define your culture, to save yourself time, energy, money, and create greater efficiency, which also obviously leads to higher employee engagement. And I love how you just said that if that person hadn't gone back and readjusted and come back because of the way that you set that up, you wouldn't have been able to give them as good of an answer. And so clear lines of communication, expectations, and leadership is top down. So what a great example.
Yeah, thanks. And it's that concept, help me help you help me. You're coming in with a question, I can give you the answer, but it's much easier if you give me a really clear background and a very clear recommendation of what you need an answer to. I can give you that answer, and ultimately that means you're going to go away and be able to do your role and your job way better and way more efficiently, which is going to help me, because then that means that we're all moving forward at the right speed. So yeah, and it's not easy, right? Like that person, we relatively recently integrated this protocol and this process into the business, so it's quite fresh in people's minds. and they still sometimes forget to use it. And it's just, luckily we do it in a very jovial way. It's not you're getting shouted at for not using the framework. It will be a laugh and say, I didn't hear the S part of that handover there. Do you want to start again?
It's like in the movies, right? You never want to be working for the bad guys, because you mess up, usually it's over. So
yeah, exactly.
It's good. You want a positive environment where mistakes are not used to beat people up. They're used to learn and improve processes, create true best practices.
Absolutely, 100%. Yeah.
So as we at the halfway point here, time for a quick shameless plug for Top Talent Accelerant. So at SSI, we've been helping our partners for almost 9 years improve better outcomes in terms of offer acceptance rate and decreasing annual voluntary turnover and having higher retention rates. So we have the ability to help our partners customize their interview process to delineate between cultural fit and the technical skill in any functional area. So again, as we talked about earlier, higher employee engagement, less wasted resources, and the ability to move more efficiently to sustainable, profitable growth. Top Talent Accelerant creates a remarkable candidate experience using video technology and branding that differentiates our partners' opportunities from the white noise and the competition of other opportunities. The partner experience brings video technology and additional tools to vet for cultural fit back to our partners, and everything happens in real time. So it creates tremendous efficiency so that our partners don't miss out on top talent that has multiple opportunities.
Thank you for tuning in to this episode of the SSI Executive Conversations Podcast. For more information on Inovus Medical and Elliot, make sure to check out the links below. And make sure to subscribe wherever you listen to podcasts, and find us on the web at shurigsolutions.com.